She's been dead for 62 days. Yet her chest still rises under the ventilator's push, a mechanical tide that never asks permission. The fetal monitor spits out a clean, stubborn rhythm, one life insisting inside a body that no longer owns itself while her mother sobs. Let her go, and the baby's father shoves a court order at my scrubs, like it's a shield. Then the charged nurse leans in and whispers, "Doctor." This started at week 20. The IQ at 314 has its own weather, fluorescent chill, the sour sting of disinfectant, and the stale ghost of coffee that's been reheated too many times to still be called comfort. The monitors speak in bright green numbers and small, relentless alarms. Each beep a metronome for bodies that have forgotten how to keep time on their own. My stethoscope hangs heavier than it should, as if it remembers every chest it has listened to tonight, and my hands smell faintly of alcohol gel no matter how many times I rinse them. In this place, you can feel the building breathing through the vents, steady and indifferent. I'm called to bed 7 by a sound that isn't an alarm. Not exactly its crying, muffled behind the glass door. The kind that makes nurses look away because it asks for something no one can chart. When I step into my comfort, the lights are low because someone once decided grief should have softer shadows. The woman in the bed lies with an almost insulting calm, skin warm and intact, hair brushed, lips moisturized, a patient prepared for the illusion of sleep. The ventilator hums, pushing air in and pulling it out with the patience of a machine that never learned what the word enough means. Her name is Marisol Vega, 29 years old. Declared brain dead after a massive intracranial hemorrhage that no one could reverse. The chart reads like an obituary disguised as medicine apnea test. Absent brainstem reflexes, to physicians, chimney of death. And yet here we are, still tapping her veins for blood draws, still turning her body to prevent pressure ulcers, still adjusting vasopressors to keep her blood pressure from collapsing into silence. On the wall, a laminated sign says maternal fetal medicine consulted, and underneath that, a second sign in bold letters, do not discuss case in hallways. The first time I met her, she had already been dead for weeks. I remember because I had reached instinctively for her wrist, expecting warmth to mean presence, and felt only the stubborn continuation of circulation we were manufacturing for her. The nurse Dasha, night shift. Eyes always a little red from living in this building's artificial dawn, said quietly, "Don't do that to yourself, Doc." She didn't mean the wrist. She meant the hope. I nodded anyway, because nodding is what you do when there's nothing else to offer. Tonight, the fetal monitor is strapped across Marisol's abdomen, gel cold against skin that cannot flinch. The screen flickers with a heart rate in the 150 strong, regular, shamelessly alive. 20 weeks became 21, then 22, then 24. And now we're hovering around the thin, terrifying edge where neonatology stops saying impossible and starts saying maybe the obstetrics. Resident whispers terms like viability, steroid window, magnesium, as if language itself could build a bridge over the void. When the baby kicks, the monitor catches it and the sound comes out like static applause. In the corner, her mother sits in a chair that was designed for visitors but has become a punishment. Mrs. Vega's hands are swollen from clenching, nails bitten down to soft crescents, a rosary looped around her fingers so tightly it leaves marks. Her eyes keep drifting to Marisol's face, as if waiting for a blink that will never arrive. Then snapping away to the ventilator tubing with something like betrayal. "That's not her," she says to no one, voice cracked from repetition. "That's just equipment." Her grief is precise. It knows exactly what it is grieving, and it refuses the substitute. Across from her stands Ethan Price, the baby's father, wearing yesterday's suit and today's panic. He has that particular kind of exhaustion you see in people who have been sleeping in courtrooms and hospital lobbies. Skin too tight over the cheekbones, eyes too shiny, words practiced until they sound like a speech. He holds a folded document in his hand like a talisman. "You can't stop," he says before I even introduce myself, as if the room has been training him for battle. The judge ordered continued support. She would have wanted our child to live. I watch him carefully, not because I suspect him of malice, but because desperation can mimic entitlement. In his mind, this is still a love story, a woman sacrificed so their baby can arrive. In Mrs. Viga's mind, it's this occasion her to turn a vessel without consent. In the mind, it's something worse than either version, because I can see the seams, the lines where law ends and medicine is forced to pretend it's morality. I clear my throat and feel the dryness scrape like sandpaper. We're maintaining physiologic support. I say, the safest phrase I know, clinical enough to hide behind. We're monitoring for infection, endocrine instability, hypotension. Our goal is to maximize fetal outcome while you keep her body, Mrs. Viga cuts in, and the word body lands in the room like a slap. She doesn't say daughter. She doesn't say Marisol. She refuses to give this situation the dignity of personhood. Her gaze bores into me. She is gone. I held her hand when they told me. I kissed her forehead. "Why are you doing this to her?" The charge nurse slips in behind me, silent as a shadow, and touches my elbow, one light tap that means the unit is listening. "Doctor," she murmurs, low enough that only I can hear. "Legal is on standby. Ethics, too. They want you to document the family meeting. In this hospital, documentation isn't just record keeping, it's a life raft. Every word becomes a potential exhibit. Every hesitation becomes a liability." I glance at the ventilator settings, at the pressers dripping into Marisol's central line, at the urine bag collecting output like proof of function. The body is responding because we are forcing it to respond, and that fact makes my stomach tighten with a kind of quiet nausea I can't name. I think about how we teach students that brain death is death, period, legally, medically, ethically. Then I look at the fetal heart rate tracing, bright and relentless, and feel the way this case tears at definitions like wet paper. I'm not tamponise, and I mean it is gay. I'm here to keep everyone safe, the baby included. Ethan steps closer, voice dropping into something almost pleading. "If you stop, my son dies," he says, and he doesn't say fetus, because fatherhood changes vocabulary. "And I'll have to live knowing you chose to end him." Mrs. Viga shakes her head hard, tears spilling without permission. "And I'll have to live knowing you kept my child like this," she whispers, pointing at the bed, at the tubes, at the illusion of breath. Between them, I stand holding a pen and a badge, and an authority that suddenly feels like theft. The monitor beeps on, steady, indifferent, and I realize with a sharp, cold clarity that the hardest part isn't the medicine. It's that everyone in this room is right in a way that breaks something in me. Outside the glass, the hallway hums with other lives, other crises that can be solved with sutures and antibiotics and time. In here, the crisis is the question itself, and it is no clean answer, only paperwork. Court orders, and the sound of a child's heart beating inside a woman who will never hear it. At 4:02, the ventilator alarm changes pitch, sharper, more insistent, like it's learned panic. The waveform on the screen stutters, compliance dropping, and the respiratory therapist Nina, hair in a messy bun. Eyes, already scanning, leans into auscultate lungs that no longer belong to a person. I step closer and smell it before I see it. That sour, sweet edge that rides on bad secretions, infection brewing in a body that can't cough. The suction catheter slides down the endotracheal tube and comes back with thick, yellow-green mucus, and the room tightens around the truth we've been refusing. The longer we keep this going, the more the body fights back by falling apart. Tasha reads the vitals out loud with the steadiness of someone reciting scripture in a storm. Temp 394. Heart rate 128. Map is slipping 58, 55. The pressor pump ticks faster. Norepinephrine, running like we're trying to outrun biology. Fever in a brain-dead patient isn't discomfort. It's danger. Systemic inflammation chewing through organs we're trying to preserve for a fetus. I watch the urine output trend down and feel the familiar dread of sepsis. The way it doesn't announce itself so much as it expands until it fills every corner of the case. We draw blood cultures, start broad-spectrum antibiotics, adjust ventilator settings, and it all feels like repairing a ship that was already declared sunk. The obstetrics resident appears, bleary-eyed, clutching an ultrasound machine like a shield. The gel is cold. The probe presses into Marisol's abdomen. And on the screen, the fetus swims in grayscale, curled and impossibly small, heart still ticking like a promise. FH are stable, the resident says, then hesitates. But maternal lactate is rising if she decompensates. We lose placental perfusion first. She doesn't finish the sentence because no one needs her to. In the hallway, I find Ethan pacing like a caged animal, phone pressed to his ear, voice tight. When he hangs up, he turns on me with eyes that have been sharpened by sleeplessness and fear. Is he okay? He asks, and the pronoun he lands heavy is already naming the baby as a full person with a future. Behind him, Mrs. Vega stands with a chaplain, the kind with gentle hands and tired eyes, whispering prayers that sound more like bargaining. She's getting worse, I say, and hate myself for how clinical it sounds. We think she has an infection. We're treating it. Mrs. Vega's face collapses in a way that's almost relief, and then guilt flashes through it like lightning. So this is it, she says softly. This is God telling you to stop. Ethan's jaw clenches so hard I can see the muscle twitch. No, he says. This is you looking for an excuse. The chaplain raises a palm as if peace can be physically held back. I want to tell them that infection is not divine instruction. It's what happens when you keep a body functioning without the brain's orchestration, without the protective reflexes, without the immune system's usual rhythm. But explanations don't soothe when the wound is moral. Back in bed 7. The monitor tones flatten for a moment, blood pressure dipping into the 40s, then rebound as we push fluids and titrate pressors. Nina adjusts the ventilator, increasing PEEP, trying to keep alveoli open that want to collapse. She's stiff. Nina mutas. ARDS is coming. I nod, watching the oxygen saturation hover in the low 90s, despite rising support, and feel the case narrowing like a corridor. We are not simply maintaining. We are escalating. Every intervention buys time by spending something else. Kidneys, lungs, skin, integrity. At 5:10, the neonatal team joins the huddle because viability isn't a switch. It's a spectrum of fragile statistics. Dr. Lanning from neonatology speaks softly, but her words carry weight like lead. At 24 weeks, survival is possible, she says. But morbidity is high IVH, chronic lung disease, neurodevelopmental impairment. Every day we gain matters. But we also need maternal stability. When she says maternal, I flinch at the word. Because it implies a mother, and the woman in the bed cannot consent to that role anymore. Still, the fetus is alive, and the placenta does not care about our language. The ethics pager goes off, then legal. The hospital's risk manager appears in scrubs that look to clean, holding a clipboard and a smile that doesn't reach her eyes. We need to be very careful, she says, as if care is the problem. The court order is clear. Withdrawal without judicial modification could expose the hospital and providers. Her gaze flicks to the fetal monitor tracing. The one thing in the room that looks uncomplicated. We must document every effort to sustain the pregnancy. Tasha catches my eye when the risk manager leaves, her expression flat with a fatigue that borders on anger. So we're just doing this, she says, low. Her voice isn't a question. It's an accusation aimed at the air, at the system, at me. I look at Marisol's arms bruised from lines. tape pulling at skin, and think about dignity as a concept that dissolves when no one can agree on its definition. We're doing what the law says. I answer, and the words taste like metal. Then the crisis becomes physical in a way the law can't ignore. Marisol's abdomen tightens under the sheet. The monitor shows uterine irritability, subtle but present, and the OB resident's eyes widen. She's contracting, she says. Not strong, but it's there. The fetus isn't ready. 24 weeks is a cliff edge, and labor is the wind. We start magnesium for neuroprotection, steroids for fetal lung maturity, and I sign orders with a hand that feels detached from my mind. Every medication becomes a sentence in an argument we're having with nature. At 6:03, Mrs. Vega's sobs become loud enough that nurses from other rooms pause, drawn by the sound like gravity. Please, she begs, pressing her forehead to the glass. Please, don't make her rot for this. Ethan stands beside her, voice cracking for the first time. Please, he says, too, but his plea runs the opposite direction. Please, don't let my son die, because you're uncomfortable, to people praying to the same silence, asking for opposite miracles. In bed, Setchi, the fever persists, the pressors climb, and the fetal heart rate remains steady, defiant, beautiful, merciless. I stare at the monitor and feel a cold thought settle in my chest. If the body fails, the pregnancy ends, and the argument becomes moot. If the body holds, we keep doing this, and the argument becomes the rest of our lives. Either way, the crisis is no longer about whether we can keep her alive. It's about what it means to do so when she is already gone. The ethics meeting doesn't happen in a chapel or a courtroom. It happens in a windowless conference room that smells like toner and stale pastries, because even moral crises have to fit into a schedule. The table is too shiny, reflecting our tired faces back at us like a second set of witnesses. On one side sits Mrs. Vega with the chaplain, her shoulders hunched, a woman made smaller by grief. On the other side sits Ethan with his attorney, a man made sharper by fear. Between them, me, the OB attending, a neonatologist, a social worker, the hospital lawyer, and a committee chair who keeps saying the word stakeholders like it's humane. They ask me to summarize the medical facts, and I do, because facts are the only thing that don't argue back. Brain death, legally death, physiologic support maintaining circulation and oxygenation. Current complications, sepsis, respiratory failure, uterine irritability. Fetal gestational age, 24 weeks and change, with a plan to reach at least 28 if possible. I hear myself speak and feel dissociated, as if I'm narrating someone else's story. The committee chair nods solemnly, scribbling notes. And I wonder how many tragedies can fit on one legal pad. Mrs. Vega's voice trembles when she speaks, but her words are clear. My daughter never wanted this, she says. She told me if anything ever happened, don't keep me on machines. She presses a hand to her chest as if holding herself together. She's Catholic, yes, but she believed in dignity. This is not dignity, this is using her. The lawyer across the table asks, if there is written documentation, a living will, anything signed. Mrs. Vega's face hardens. We didn't think we needed paperwork to love our child, she says. And the room goes quiet because no one wants to be the person who answers that. Ethan leans forward, knuckles white on the table. She was pregnant, he says. She was excited. She picked names. She showed me the ultrasound and cried. His eyes dart to me, begging me to validate his version of her. You're telling me you can save our baby? You can. And you won't because her mother can't stand looking at her. His attorney slides the court order across the table again, as if paper can override grief. The court has recognized the fetus's interest, the attorney says. The hospital is obligated to continue treatment. The OB attending, Dr. Sato, clears her throat. We need to be honest about what continuing support entails. she says, voice calm but firm. This isn't passive. It's active medical management of a deceased patient's body to sustain a pregnancy. Complication escalate increase. There may be hemorrhage, coagulopathy, cardiac instability. At some point, we will face an emergency C-section, potentially at a gestational age with profound morbidity. She looks at Ethan, not unkindly. And there are outcomes where the baby survives, but suffers severe disability. Ethan's eyes flash. So, because it might be hard, we should just end him? The neonatologist speaks next, not with certainty but with percentages that sound cruel when spoken aloud. Survival rates, morbidity curves, the incremental benefit of each week gained. She emphasizes uncertainty. Mrs. Vega hears uncertainty as permission to stop. Ethan hears it as an argument to keep trying. I sit there listening to them translate human lives into probability and feel sick. Because I know the numbers are real and still not enough. This isn't a medical decision disguised as ethics. It's an ethical decision disguised as medicine. The hospital lawyer turns to me and asks the question that has been pressing on my ribs for weeks. Doctor, do you believe continued support is medically appropriate? The room stills. Everyone looks at me, because in a hospital, the final justification must be clinical, even when the truth is not. I think about appropriateness in the strictest sense. Does this treatment benefit the patient? And then the brutal clarity. The patient is dead. There is no patient benefit, only fetal benefit, and even that is contingent. It's medically possible, I say carefully, and feel the cowardice in it. Whether it's appropriate depends on what we believe our obligations are to the fetus and to Marisol's prior wishes. Mrs. Vega's eyes fill with tears that don't fall. They cling like they're afraid of the drop. So you don't know, she whispers, and her disappointment cuts deeper than anger would. Ethan's voice rises. He's not dead, he says, pointing at the fetal heartbeat tracing printed in the chart. Listen to it. That's life. The chaplain murmurs something about sacredness. But sacredness doesn't tell us what to do when two sacred things collide. After the meeting, the social worker pulls me aside in the hallway. The family is asking to see her without the monitors, she says. They want a moment that feels like goodbye, not like a science experiment. I nod, already imagining the scene. Mrs. Vega stroking hair that won't respond, whispering prayers into ears that can't hear. Ethan staring at the belly, as if proximity can become paternity. I also imagine the nurses' faces, the way they'll flinch at turning off alarms, even temporarily, as if silence might be mistaken for permission to stop. The fever spikes, Arden. The antibiotics are running, but the cultures are pending, and the body is becoming a battleground. Tasha adjusts the sheet, covering Marisol's bruised arms. A small gesture of modesty offered to someone who cannot receive it. I hate this, Tasha whispers, not to me but to the room. Nina checks the ventilator circuit, jaw tight. Every clinician here is complicit, and every clinician here is trying to find a way to be less so. I step to the head of the bed and look at Marisol's face, at the taped eyelids that keep corneas from drying, at the mouth held slightly open by the tube. I think about consent the way we teach it autonomy, informed choice, the patient's right to refuse. Then I think about pregnancy, about how our culture treats it like a communal project. And I feel the dread of what this case says out loud, that a woman can die and still be argued over, still be owned by competing claims of love. The dilemma solidifies into one question that no protocol can answer. If we continue with the femme ostensibly her wishes, turning her body into a means. If we stop, we end a viable life that cannot speak for itself and will never get a second chance. I stand there listening to the ventilator's steady push and pull and realize that either decision will leave a scar. Not just on the living, but on the people who have to carry out the order with their own hands. It happens the way catastrophes often do in the ICU, not with drama, but with a number that turns wrong. The arterial line tracing collapses into a shallow, frantic wave. The map drops into the 40s and doesn't come back with the usual tweaks. Tasha's voice tightens, pressures tanking, norepi maxed. Vasopressin already running. Nina looks at the ventilator screen, then at me. Oxygenation's worsening. She's not moving air. The room fills with that sudden, sharp focus that turns humans into instruments. I press fingers to Marisol's skin and feel the heat of fever, the clammy sweat that isn't hers. The labs come back like a punch. Lactate climbing, creatinine rising, platelets falling. The body is sliding into multi-organ failure, sepsis chewing through every system we've been propping up. And then the fetal monitor steady for weak stutters. The heart rate dips, recovers, dips again. The baby, sheltered inside, is starting to feel the collapse of the world sustaining him. The OB attending arrives in a rush, coat half on, hair still damp from a too-fast shower. She scans the strip and swears softly, a rare crack in her composure. "We're seeing decelerations," she says. Placental perfusion is failing. The neonatologist follows, face pale, already calculating ventilator settings for a body that might soon fit in the palm of her hands. Behind them, the charge nurse closes the door not to hide the reality, but to contain it, like you can keep tragedy from spilling into the hall if you shut it in. The hospital lawyer appears, summoned as if by the scent of impending liability. "We need to know what your plan is," she says, voice controlled. The court order is still in effect. Continuing support is mandated. But no court order can command a failing body to keep obeying. Dr. Sato turns to me, eyes fierce. "This is turning into an emergency," she says. "If the fetus is crashing, we may have to deliver." The words land with a sickening weight. Deliver a baby from a dead woman's body, not because she is in labor, but because the body is dying again. We gather outside the room for a quick huddle, the kind of team meeting that is really just a shared breath before a leap. Gestational age 24+5, neonatology says. "We can attempt resuscitation, but outcomes are uncertain, doctor." Sato's eyes flick to the fetal strip. "If we wait, we lose him. If we go now, he's extremely premature." The lawyer clears her throat. "The court order supports continuing life support for the fetus. An emergent delivery could be consistent with that." She says it like a loophole, like a solution. But the truth is uglier. We are deciding how to cut. Mrs. Vega and Ethan are brought into a family room because no one should hear these words standing over a ventilator. I walk in with Dr. Sato and the social worker, carrying the news like a loaded weapon. Mrs. Vega's face is already strained, as if she has been bracing all night. Ethan stands, hands shaking slightly. "What's happening?" he asks. Dr. Sato speaks plainly. Marisol's body is failing. The baby's heart rate is showing signs of distress. "We may need to perform an emergency C-section to have any chance of saving him." Mrs. Vega's breath catches. "Gucci her," she whispers, horrified, as if the word is violence on top of violence. "She's dead," Ethan says, voice cracking. "She doesn't feel it." Mrs. Vega turns on him with a fury that finally breaks through her grief. "You think feeling is the only thing that matters," she spits. "You think her body is just property now." Ethan flinches as if slapped, then steadies himself. "It's our son," he says. "He deserves a chance." The social worker's eyes flick to me, silently pleading for me to anchor this, to make it medical enough that they can survive hearing it. Back in bed 7, the fetal heart rate drops again, longer this time. A deep deceleration that makes the strip look like a cliff. Dr. Sato doesn't wait for consensus anymore. Emergencies erase democracy. "We're going," she says. "OR now, unless we can do it bedside faster." The ICU isn't an operating room, But sometimes it becomes one because time doesn't care about sterile ideals. The team mobilizes with practice speed. Surgical trays, betadine, sterile drapes, blood products. Nina increases oxygen. Tasha primes additional pressors. The ventilator hisses like an animal cornered. We move Marisol carefully, reverently, absurdly don't thee how. Her bed rolling under fluorescent lights, the fetal monitor still attached. The ventilator bagging her breaths, as if we're escorting her to a birth she cannot witness. In the elevator, the only sound is the hum of machinery and Ethan's breathing, too loud, too fast. Mrs. Vega doesn't come. She can't. She stays behind with the chaplain, praying not for salvation now, but for forgiveness. In the OR, the air is colder, the lights brighter, the world more clinical. Dr. Soto scrubs in, hands steady, eyes red-rimmed but focused. I stand near the head of the bed, watching the ventilator, watching the pressure, watching the thin line between function and collapse. The anesthesiologist looks at me with a question that has no right to exist. Do we need paralysis? For a dead patient, the absurdity makes me dizzy. No, I say, voice tight. Just keep her stable, stable. The word has become a prayer we no longer believe in. The incision is swift, precise skin, fascia, uterus each layer opened with the calm brutality of surgery. There is blood, of course, because blood doesn't care about declarations of death. The uterus contracts reflexively when touched, a cruel reminder that the body still has its own rules. Doctor. Soto reaches in, hands disappearing into the opening. And then there is a pause, one breathless moment before she lifts out a tiny, slick body, bluish, limp, cord pulsing faintly. Baby out, she says, voice flat because emotion would shake her hands. Neonatology takes over instantly, moving the baby to the warmer. The room splits into two realities. At one end, surgeons managing hemorrhage in a dead woman. At the other, a team trying to coax air into lungs that were never meant to meet the world this early. Heart rate 60. Someone calls. Start compressions. The tiniest chest rises under a ventilator the size of a lunchbox. A nurse places a mask so small it looks like a toy. Someone threads an endotracheal tube with hands that never tremble. Not because they aren't human, but because they have learned to hide it. I glance at Marisol's face, still and taped, and then at the baby's frantic resuscitation, and feel a strange, unbearable fracture in my chest. The sense that we have stolen something from her, and also saved something because of her. The monitor on Marisol's side alarms. Pressure drops again, blood loss mounting. We're losing maternal support, anesthesia calls. Dr. Soto curses under her breath. The body is collapsing, and the surgery becomes a race to finish before the vessel breaks. Achi the warmer, the neonatologist's voice cuts through the noise. Heart rate rising 90. 110 thin. Reedy cry finally escapes. Not strong, but real. It slices through the OR like light through fog. Ethan makes a sound that is half sob, half laugh, collapsing into a chair as if his bones have stopped working. In that moment, the baby is alive. And Marisol, in the next room of reality, is still dead, and now also opened, emptied, stitched, handled. The climax doesn't feel like victory. It feels like a cost paid in a currency no one agreed to spend. After the OR, the ICU feels strangely quiet, as if the building has exhaled and forgotten we're still inside it. The storm of voices, alarms, and metal has been replaced by the soft hiss of vents and the muted roll of carts in the hall. Marisol is brought back to bed 7, her abdomen bandaged, her body arranged again into something that resembles rest. The ventilator continues, out of habit more than necessity now. The court order has been satisfied in the only way biology would allow. I sign orders with numb hands, feeling like I'm filing paperwork for a shipwreck. The baby Eli, Ethan insists immediately. The name spoken like a claim is in the NICU, under blue light, skin translucent, ribs visible with each shallow breath. The neonatologist briefs us in clipped, careful phrases. Intubated. Surfactant given. Lines placed. Temperature unstable. At risk for brain bleed. At risk for infection. At risk for everything. Yet alive. The word feels both miraculous and cruel. In the NICU, survival is not a single event. It's a long siege, and every day is another round fired. Ethan sits outside the NICU, hands clasped, staring through glass at a child he cannot yet touch. His face is wrecked in the way joy can wreck you when it's born out of horror. "Thank you," he says when I approach, voice hoarse. He means it, I can tell. But gratitude in this case feels like an accusation anyway, because what exactly is he thanking me for? For doing my job, for violating someone's dignity, for saving his son, for all of it tangled together. I nod because anything else would be too complicated to survive. Mrs. Vega is in a different kind of quiet. She sits beside Marisol's bed now that the fetal monitor is gone. And without it, the room looks like what it always was, a vigil. The chaplain stands behind her, hands folded. Mrs. Vega doesn't cry at first. She just stares at her daughter's face with a focus so intense it looks like she's trying to will her back into existence. When she finally speaks, her voice is flat. "So it's done," she says. Not a question, a verdict. I tell her the baby is alive, because truth matters even when it hurts. Her eyes close, and one tear slips down, slow and silent. "A baby," she whispers, and the word isn't warm, it's heavy. "And my daughter was cut open for him." The chaplain murmurs something about sacrifice. But Mrs. Vega's hand lifts sharply, stopping the words before they can land. "Don't," she says. "Don't make poetry out of this." I feel a surge of respect and shame at the same time, because she is right. Language can be a way of cleaning blood off the floor. We discuss withdrawal of support, now uncomplicated legally because the pregnancy is no longer a factor. The hospital lawyer is present again, suddenly gentle, suddenly ready to call it what it is, end of life. The irony twists in my gut. We have spent weeks pretending this was care. Now, when the reason for the pretense is gone, we can finally speak plainly. Mrs. Vega nods quickly. "Yes," she says. "Please." Let her rest. Her voice breaks on the last word, and I understand then that rest is what she has been asking for all along, not for Marisol's body, but for her own mind. In the room, we turn off the ventilator alarms first, because the beeping after death is obscene. Nina disconnects the tubing with a kind of tenderness that feels like apology. Tasha removes, tape carefully, as if skin can bruise from indignity alone. I explain what will happen. Even though Marisol cannot feel it, oxygen will stop, blood pressure will fall, the heart may beat for a while, then it will stop. The explanation is for the living, not the dead. Mrs. Vega holds her daughter's hand and whispers in Spanish. Words too soft for me to catch, and I don't ask because some sentences belong only to family. Ethan does not come. He stays in the NICU, arguing with the universe in the only way he can, by staring at Eli's tiny chest rising and falling. I can't blame him. His grief has no place in Marisol's room. It would be swallowed whole by Mrs. Vega's. Still, the absence feels like another wound. A child has been born, and already there is a split story, two versions of love that will never reconcile in one room. When we withdraw support, the room doesn't erupt into anything dramatic. The ventilator's hum fades. The monitor's numbers drift downward like leaves in slow water. Mrs. Vega's grip tightens, then steadies, as if she is anchoring herself rather than Marisol. When the heart finally stops, it is almost anticlimactic, a soft cessation after so much noise. I pronounce the time, and the words feel useless, because Marisol's death has been pronounced before, and yet this is the moment her mother will remember. Afterward, the nurses clean the room in silence, wiping surfaces, removing tubes, restoring the bed to neutrality. It's a ritual we do to regain control, to pretend we can tidy up what happened here. I stand in the doorway watching them and feel a hollow ache behind my sternum, a fatigue that isn't from lack of sleep, but from too much meaning. In the NICU, a baby breathes through plastic and borrowed oxygen. In the ICU, a mother finally begins to mourn. And I, somewhere between those units, realized that medicine didn't solve anything. It only carried the conflict to its next stage. When my shift ends, the sun is already up, pouring indifferent light over the parking lot like nothing happened. The world outside the hospital is to normal people buying gas. Kids in backpacks, a dog tugging at a leash, ordinary life moving with the arrogance of health. I sit in my car and realize my hands are still cramped in the shape of work, fingers curled as if holding invisible lines. Invisible syringes, invisible decisions. The badge on my chest catches the sunlight, and I think about how thin the metal is compared to what it authorizes. I drive home past billboards and coffee shops, but my mind stays in bed 7, in the OR. In the NICU, I keep seeing Marisol's face, tape over eyelids, lips slightly parted around a tube, a body made into a site of argument. I keep hearing Mrs. Vega's voice. Don't make poetry out of this. It follows me like a rule I should have learned earlier. In medicine, we tell stories to survive, but sometimes stories become a way of avoiding the ugliness of what we did. At home, I shower until the water turns cold, trying to rinse off the feeling of betadine and blood and moral exhaustion. I press my forehead to the tile and let the sound of water fill my ears, because silence is dangerous. Silence lets the questions in. Did we honor Marisol or erase her? Did we save a life or take advantage of a death? The worst part is that the answers aren't mutually exclusive. The hospital taught me to think in binaries: alive, you're dead, treat, or don't treat, but this case lived in the gray like it was built for it. A week later, I visit the NICU on my day off, not because I'm needed, but because I can't let the story end without seeing what we created. Eli is still impossibly small, skin more fragile than paper, a constellation of monitors and lines mapping his struggle. The nurses move around him with a softness that looks like reverence. Ethan is there, too, wearing scrubs over street clothes, learning the language of alarms and oxygen saturations the way new parents learn diapers and lullabies. When he sees me, his eyes fill. He opened his eyes yesterday, he says, and for a moment the joy is pure. Then his face shifts, and the grief leaks in around the edges. I don't know how to carry this, he admits quietly, voice cracking as if honesty is finally safe here. I wanted my son. I wanted her. And now I have one and I lost the other. And everyone looks at me like I'm the reason. He doesn't say villain, but the word hangs behind his teeth. I think about how easy it is for a story to choose a bad guy because it makes the pain orderly. Real life doesn't do orderly. Real life spreads blame like fog. Mrs. Vega doesn't visit the NICU, at least not while I'm there. The social worker tells me she asked for updates, asked if the baby is okay, then cried and said she couldn't see him yet. I understand. Seeing Eli would be like accepting the trade, like agreeing that Marisol's body was worth spending. Grief can't be forced into reconciliation on a timeline. The social worker says gently, she calls him the baby, not his name. Names, I've learned, are where dignity begins. The hospital holds a debrief, the kind that pretends to be about clinical learning but is really about emotional containment. We talk about infection control, hemodynamic management, coordination with legal communication strategies. No one says the word violation. No one says the word incubator. We orbit the truth, the way planets orbit a black hole, aware of it, shaped by it, unwilling to look directly. Tasha speaks once, voice low. We need a policy, she says. Because I can't do this again without knowing what it means. Heads nod. Policies are how institutions protect themselves from feeling. I find myself thinking about Marisol as a person, beyond the case. I asked the nurse, who knew her longest, what she was like before. She laughed loud, Tasha says, surprising herself with a smile that quickly fades. She had this little dimple. She hated hospitals. She used to say she'd never be one of those people who lived here. The irony is so sharp it makes my throat ache. In the end, she lived here in the most literal way, her body a resident. Her chart a permanent fixture, her name spoken in huddles like a diagnosis. I also think about the baby, and the way everyone in the NICU calls him a fighter. We love that word because it makes suffering sound noble. But he didn't choose a battle. None of them did. Marisol didn't choose to hemorrhage into her brain. Mrs. Vega didn't choose to watch her daughter's death stretched into months. Ethan didn't choose to learn parenthood through glass and ventilators. And I didn't choose to be the doctor who had to keep a dead woman's blood pressure up so a fetus could grow. Yet choice is the language we use, because without it, we'd have to admit how much is decided by chance. On my next night shift, I pass bed 7 and feel a reflexive flinch, like my body remembers the shape of the room. There's a new patient there now, alive, sedated, sleeping through the storm of their own illness. The monitors beep the same way, but the beeps feel different because my brain attaches them to memory. I pause at the doorway for a second longer than necessary, and Nina brushes past me with a bag of tubing. "You okay?" she asks, not looking up. I nod, because that's what we do, and because the question isn't really asking for truth. It's asking if I can keep functioning. The scar, this case left, isn't visible, but it has changed the way I touch a chart. The way I speak to families. The way I say the word patient. It taught me that death can be declared and still not be allowed to end. That law can command medicine and medicine can still fail, and that love can become a weapon when it's desperate. Most of all, it taught me that dignity isn't a thing you can measure like blood pressure. It's something you either protect with intention or lose by default, one order at a time. I don't have a clean lesson to offer, because clean lessons are for stories that lie. What I have is a memory, a premature cry in an operating room, thin but heao, and a mother whispering goodbye to a daughter who couldn't hear it. Between those two sounds, the beginning of a life and the end of a person, there was me, trying to be a healer in a place where healing wasn't possible, only choices. And I carry that with me now, not as inspiration, but as a reminder that medicine is not just science. It's the careful, often painful stewardship of what it means to be human when the body stops cooperating.